All right, everybody, welcome into Chapter 2 of First Aid CPR. Today we're going to talk about actual actions you will take at an emergency situation and how you will face them. First and foremost, we have to define what emergencies are. This is a quiz question, so make sure you put a star by it. But all emergencies have 5 characteristics. All emergencies are dangerous, they are unusual and rare, different from one another, unforeseen, and urgent. So dangerous being they can cause harm to somebody. Unusual and rare being that they don't happen every day. This isn't something that you're going to see periodically. Different from one another meaning that no two emergencies are exactly the same. There are little nuances that make them unique. Unforeseen being that you can set up things to prepare you for them, but you don't know exactly when they're going to occur. And the last one, urgent, being that time is a very important factor of how we treat emergencies. So as a bystander, a first aid provider, those can kind of be interchangeable. But you have to make a series of decisions quickly and reliably as a bystander. So this is kind of an overview of what we'll go over in this chapter. First, we have to be able to recognize an emergency. Then we have to decide whether or not we're going to help. Call 911 if emergency medical services or EMS are needed. Check on the injured or ill person, and then give first aid that we can provide. So a couple of things when talking about us as first aid providers or bystanders, especially in emergency situations involving those that we don't know, or just in these big emergencies in general. In public places, bystanders are less likely to help for a few different reasons. First, they may lack the knowledge needed to provide care in those times. They may be confused about whether it is an emergency or not, or other factors, right? If there's things that people don't understand, maybe something that deters them from that situation. But it is not always clear whether something is actually an emergency or not. And we're going to talk about that. The other thing to be aware of when it comes to bystander actions, not all bystanders have adequate training. They may not understand what they need to do in those situations, and so therefore it can be somewhat dangerous. They can make poor decisions or do things incorrectly, maybe based on outdated information. Things like that can pose a problem, actually. So, speaking about recognizing the emergency, okay, some things that we have to recognize about these situations. First, we have to understand the severity of the situation. If it's a catastrophic thing like a vehicle crash, or if there's several vehicles, understanding how bad it actually is the first thing. Next, we have to understand how close you are to the emergency situation, right? Like if you see a fire that's blocks and blocks away, you might not be quite as likely to notice it, or you may not be able to help because you are too far away or don't have the means to get there. If you know the person, as far as relationship goes, you're more likely to help in an emergency. So sometimes you won't recognize certain emergencies because you don't know the person, especially if you don't know their personality and those types of things. But when it's somebody you know, you tend to hop right on it, right? Especially for like if they're your kids or your family members. Time that you are exposed to the emergency also plays a role. Evidence has indicated that the longer that a bystander is aware of a situation, the more likely they are to recognize that it's actually an emergency. If you're driving by on the freeway and you see something, you may not notice that it is an actual emergency. You may have no clue. It may just seem like a normal situation going on. Whereas if you are there, stopped, and you can process what's going on, it may be easier to know, to see. Conditions of the scene play a big role, like whether you're able to see blood and things like that will flag it as an emergency to you, whereas if those things are not possible, maybe it won't. And then how the person appears, right? If somebody appears to be very in distress, then that will strike you as an emergency, whereas some people may be experiencing an emergency situation, but they are calm or they are not really struggling at that time, and so it may be hard to recognize. As far as deciding whether to help or not, do you appreciate the importance of a bystander's help? Does that person or you feel confident enough to help? Are you willing to take the time to help or not? Do you have other things that are on your mind or that are taking your attention? Do you have the potential risks of helping in perspective, right? We talked about some of the legal ramifications of being a first aid provider. Do you understand those, and are you willing to help regardless of those? Do you feel comfortable taking charge or being a leader in some of these situations? Or do you feel comfortable being around strangers, touching them, helping them, right? All these things play a role. And if you decide not to help, reasons that you may decide not to help. Would helping be harmful? Is it not worth the effort? Is there somebody already there taking care of them? Does it require skills that are outside of your lane? We talked a lot about that, above what you're capable of providing. Are the conditions really unpleasant? Do you have trouble with blood? Does blood make you nauseous or sick? Things like that. If nobody else is helping, is it really an emergency? Right? Do I really need to help them if nobody else is helping them? All these things kind of play a role into deciding whether you should help or not. The biggest thing, and we'll talk more about this in a little bit, some of these decisions, in fact, all these decisions should be made beforehand, right? What are the situations I am not willing to help in? Do I really struggle with blood? If I see blood, am I going to pass out? Am I going to create another emergency, right? All of that plays a role as well. And then, should EMS be called? Sometimes we make the wrong decision and it's not really an emergency and we call 911. Maybe we're not sure, so we ask for extra help. We try and call somebody else, but we shouldn't have. We should have called. Or maybe we don't call at all when we should have. Then it comes to checking the injured or the ill person. Like, I have to actually help that person. And we need to decide whether a life-threatening condition exists or not, or what kind of help the person needs. We're going to talk some more about that in chapter 4 as well. And then giving first aid, you have to continue until EMS arrives. And we have to determine whether that person only needs first aid or if they need additional help. Okay, so the first thing we have to determine when we see an emergency, or maybe not the first thing we have to determine, but one of the things that becomes really important is knowing when we should call 911 or not. According to the American College of Emergency Physicians, if you answer yes to any of these 5 questions, you should call 911. First and foremost, is the person's condition life-threatening? Could they die? Could this condition could potentially get worse if the person doesn't get help? If you move the person, is it going to hurt them worse? Do they have some sort of injury that they have to be in place, or moving them could cause more damage? Does the person need emergency medical services? Do they need more help than I can offer? Or would distance or travel conditions to get additional help cause delay, right? If I could take them in my car and get them just as fast as an ambulance could, then maybe I don't need to call 911. But if I can't, I should be calling 911, right? So these are some things to consider. All right. So these next 4 slides contain some specific examples of when we would need immediate transport, specifically an ambulance or EMS. These are a quiz question, so make sure you understand these and can remember these. Okay, so we'll run through these somewhat quickly, but all these are some specific examples as to why. So if somebody is having difficulty breathing that does not improve with rest, so if they've rested for a couple of minutes and they're breathing, they are still having a hard time catching their breath, they need to be transported immediately. Lasting chest or upper abdominal pain that lasts 2 minutes or more, those people need to be transported. A dangerously fast heartbeat, meaning it's more than 120 or 150 beats per minute at rest. That is a red flag. It can be dangerous. Anybody who faints or is unresponsive, if they're having a really hard time speaking to you, if they can't talk to you, numbness or weakness in any body parts, any sort of sudden dizziness that is debilitating, right? I can't walk because I'm so dizzy. Some more examples. If they're very confused or they have sudden changes in mental status, if they're able to talk to you pretty easily and then after a minute or two they can't carry on a conversation, that would be a big change. Unusual behavior. There are some people out there that are a little different, right? And so you have to, this comes more into play with people that you know. If it's a stranger that you don't know, this may be harder to determine whether their behavior is unusual or not. Anytime somebody has difficulty walking, especially if you don't have appropriate materials like crutches, a wheelchair, something like that to assist them by itself, that would probably be the only time when somebody needs immediate transport. But if it's accompanied with other symptoms like severe pain and things like that, difficulty walking is a reason to call 911. Sudden blindness or vision changes. That's a big one. Bleeding that will not stop. If you are putting direct pressure and it still will not stop, you need to call 911. Get that person to medical care immediately. Broken bones that are visible through the open wound, or if they have a broken leg. Transport becomes very difficult in those situations, and you're likely going to need 911 for that. That is not something that shouldn't be seen. You should be seen for something like that. Drowning, or if they're submerged for an extended period of time in the water, that's a reason to transport somebody. If they're any type of choking for more than a minute or two, that's a big one. Severe burns carry a very high risk of infection, and we have an entire chapter about burns that we'll talk about later. Allergic reactions accompanied with breathing difficulty is a sign of anaphylaxis, which we'll talk about in our shock chapter. Extremely hot or cold body temperature, that can become life-threatening. Poisoning or drug overdose. The last ones, sudden and severe headache or pain. Severe persistent vomiting or diarrhea can lead to dehydration, which is dangerous. Coughing or vomiting of blood. Behavioral emergencies, meaning somebody is threatening to hurt or kill themselves or someone else. That's a reason to call 911. And severe wounds, which we'll talk about in chapter 9. Some specific examples of those, but if it's a wound that is so severe, doesn't look like you can take care of it, that's a reason to call 911. So all 4 of those slides are part of a quiz question. Make sure you understand them. As far as calling 911, if you determine that a situation is an emergency, call 911 first. Don't call your uncle, don't call your doctor, Don't call, whoever, call 911 because timing is very important. Now, as far as transport, there are situations like we've talked about before that would warrant you transporting the person versus an ambulance. But here's a few benefits of using an ambulance instead of just driving that person yourself. Many injured or ill people should only be moved by trained personnel. Sometimes it's not safe to move somebody. Sometimes you need additional help to be able to do that. EMS can increase the chances that somebody survives in an emergency situation. So getting that care, even though they're just transporting them to a hospital, they provide care along the way. And that can be very vital to somebody's survival or recovery. And ambulances can get to a hospital quicker than you can. Believe it or not, whether you're experiencing an emergency or not, just putting on your emergency lights and speeding through the middle of town, driving through red lights, stuff like that, will not prevent a police officer from pulling you over. And that's just a delay. That's just a waste of time. And so using EMS, they can speed through town and run red lights and not get pulled over and experience a delay like that. Okay, so now we're going to talk about how to call EMS. There is certain things that when you call 911, you need to tell them. And these, we're going to talk about some of those. Enhanced 911 is a system that some communities do have. Enhanced 911 is where they can track you. Once you call in, they have your location. That's enhanced 911. They can also get other things like if your name's associated with your phone number and things like that, they can get all that information. But not every community has enhanced 911. Here in Ephraim, we do have enhanced 911, luckily, but some smaller communities don't have access to that. All right. So this is a quiz question. Make sure you understand this material as well. As far as calling EMS, there is a system you have to follow and a certain way that you should do it. First and foremost, you need to speak slowly and clearly. I know that's difficult because your adrenaline's ramped up in these situations and that can be hard. But you do need to slow down, make sure you enunciate so that they can understand you. And if they can't understand you, they'll tell you, right? This is just a phone call where you're speaking to a person. You're not speaking to a computer. You're not calling customer service. Okay, this is different. The following information is what you need to give. You need to be able to tell them where the emergency is located, okay? An address, if you can get that. If not, use landmarks. It's really okay. Like here in Ephraim, especially in small towns, in Ephraim, everybody knows where Snow College's football field is at. So the best landmarks you can give, the better, okay? You want to give them your phone number and your name. If for some reason the phone call gets dropped and they don't have enhanced 911, they will call you back. This is important too that, we'll talk about that on the next slide. You need to describe to them what happened to the best of your ability. And they will ask you questions. Make sure you answer those questions to the best of your knowledge. Give them the number of people who need help. If there was a car accident, you say, there's 2 cars that got in an accident. There's 3 people in one car and two people in the other. If you can get that information. If the scene isn't safe for you to go in and check on that, just give them as much information as you can. And if you can, describe the person's condition. This person is breathing, they're not breathing, those types of things. And again, they'll ask you some of those questions when you get to that moment. And make sure you do not hang up until they tell you to hang up. Likely, they'll walk you through some things. They'll talk you through how to help people and those sorts of things. So a few tips. When you talk to children about calling 911, make sure you explain for them how to do it. Make sure you tell them those things. Don't hang up until they tell you to. Make sure you enunciate, call 911. Don't say 911. The kid may look for a number 11 on the phone, and that doesn't exist. So say, call 911, okay? And make sure you teach the young people in your life how to do that. If you accidentally call 911, don't just hang up. Okay, if you just hang up and they can't get a hold of you, they'll likely call you back, but if you don't answer, they are going to send a police officer to your home. And in reality, that is a waste of a resource. That police officer could be going to help somebody instead of coming to your home. If you called accidentally and they're still on the line, explain to them, hey, this was an accident, sorry. I've had this happen before. My kids get hold of my phone and they dial 911, or those iPhones have the emergency phone call system in the lock screen, so you don't even have to get in the phone to call 911. But in those situations, you just explain it. They don't get upset. They just tell you to be a little more careful, and that's fine. Okay. If when you're on the line with 911 again, do not hang up until they tell you to do so. They may keep you on the phone. They will talk directly with the ambulance driver. Maybe they can't find you. Those types of things. So don't hang up. Another helpful tip is add EMS, fire, and police numbers to your phone. There are situations that may demand for you to call the fire station and not just 911, right? Maybe it's not necessarily an emergency, but you need the fire department to ask them for help with something, okay? Having those numbers in your phone makes it a lot easier. The other thing I wanted to add to this is if a call does drop while you're on the phone with EMS or with 911, don't call 911 again. The reason being, in some of these bigger cities and these bigger towns, they have more than one dispatch center. So if the call drops, they will call you back. Okay. If the call drops and you try and call them back, when you call 911, it may send you to another dispatch center. Well, then you have more than one dispatch center trying to send an ambulance your direction, and it's a waste of resources. So let them call you back if the phone hangs up. Okay, so a couple of things about being a bystander or first aid provider. It's not unusual after an emergency to have some some bad reactions. Um, if you struggle with the sight of blood, just because it's an emergency and somebody's dying doesn't mean that that's necessarily going to go away. And so there are some things you can do to try to desensitize yourself to those things if you know you struggle with those things. I actually had a student last semester come to me and say, hey, I actually took this class because I struggle with gory photos and gory situations. If there's blood or somebody's got a gaping wound, I have a hard time with that. And so she took the class to try and desensitize herself, meaning she would see some of those photos in this class and some of those things, and it helped her to overcome some of the fear and anxiety associated with those situations. The other thing you can do is you can distract yourself. If you're in a situation where you're becoming uncomfortable because of the environment, because of blood or other types of things, you can distract yourself using music. Sing your favorite song, right? Find a way to take your mind off what is troubling you. It is not uncommon to also experience post-traumatic stress disorder after an emergency situation. Just because you weren't the person experiencing the emergency doesn't mean that that does not create some anxiety and bring up symptoms associated with PTSD. It has been said that if you discuss your feelings within 24 to 72 hours after an emergency, if you're able to speak with somebody, a friend, family member, even a mental health professional about some of your feelings, that can help prevent some of the negative side effects and symptoms associated with PTSD. So, before we go charging into an emergency situation, we have to size up the scene first. So quickly, we will ask ourselves, are there any hazards present? If I rush into this situation, am I going to get hurt? In an emergency situation, you are better off waiting for professional help, than rushing into a situation and creating a second emergency, right? All of a sudden, you're trying to be helpful and save this person's life, by giving them CPR or whatever, and you rush into a down power line and electrocute yourself, well, you're not going to help if you are also injured. Okay, so we have to make sure that we size up this scene that it is safe for us. Okay, again, are there any hazards present? How many people are hurt, right? When I call 911, then I have this information. What is the problem? Do I even know what the problem is? If I don't know what the problem is and I rush in there and somebody's laying on the ground in pain and all of a sudden I step on a snake that just bit them and it bites me, well, again, that doesn't help anybody. Do we know what happened, right? Do we need to get a more accurate idea of what happened and speak to people? Can a bystander that is there help, or do you have to be the one that helps? Knowing those things can really help you be a better first aid provider in any given emergency. Part of that, it's okay to start to meander towards the emergency as long as you're being vigilant, as long as you're looking for these things. Okay. Another thing we have to do as first aid providers is understand some of the risks associated with helping others, and those can be diseases. Okay, you can catch a communicable disease by helping somebody, no matter what your intentions were. Okay, but there are some things we can do to prevent some of that. You must assume that anybody that is injured or ill is infected with something, and they could spread something to you if you don't take the proper precautions. Okay, and we're going to talk about those. First one is washing your hands. Wash your hands before and after contact with somebody you don't know. Okay, even somebody you do know, you need to keep your hands clean to prevent that. That will prevent a lot of spread of disease. The proper way to wash your hands, which we should all know this because of COVID, but first, use soap and warm water if at all possible. Rub your hands together for 15 to 20 seconds. You can sing the ABCs. All those things can help you wash your hands for the appropriate amount of time. Rinse them off and then dry them with a clean towel if possible. Just wiping them on your pants or something like that, you may have just re-exposed your hands to pathogens that could have been found there. If water and soap are not available, you can use hand sanitizer, but it must have at least 60% alcohol content for it to be sanitizing. When you use hand sanitizer, you apply it to your hands, rub them together until your hands dry. It will dry by itself. Okay, so now we're going to talk about some other things we do to protect ourselves from these communicable diseases. We use what's called personal protective equipment. Okay, now these are a quiz question. Make sure you understand them, what they are and what they're used for, because it's on the quiz. Okay, so the most common type of PPE are exam gloves. Anytime you are working with somebody, if you have access to gloves, you should wear them. Okay, it just protects you, but it also protects the person from you. Okay, you could spread something to that person as well. Latex free when you're performing first aid is the best. Latex is a very common allergy for people, and if you don't know the person, you could possibly cause an allergic reaction if you're wearing latex gloves. Nitrile gloves, when you're handling blood, nitrile has a very low possibility. I was looking at this the other day. Different types of gloves, the different materials of gloves can be more porous than others, right? Latex actually has little micropores that are a little larger than those in nitrile gloves. And so blood eventually could pass through latex gloves if you're not careful. Whereas nitrile has very, very small micropores and it takes a long time for anything to seep through them. The next type of PPE is masks. We all know about masks. We lived through COVID. Can help protect against some diseases. The effectiveness of masks has been debated. We've kind of I'm sure you've all have heard that. It's not the end all, but it can help prevent certain things, right? Like anytime somebody else's bodily fluids or those things enter your body through your mouth or your nose, you are vulnerable to any of the pathogens that are in their system. So wearing a mask can help prevent that. A face shield, the plastic mask that covers your ears, nose, and mouth, can be also helpful if available. Next type of PPE is a mouth-to-barrier device for CPR. If you do have to administer CPR, which entails mouth-to-mouth, using a barrier helps prevent the spread of certain diseases. The last two types are eye protection, so goggles and those types of things. That isn't an opening to your body, which different diseases or germs can enter through. And then gowns or aprons to try and keep things off your clothes, especially blood. So those are the 5 types of PPE. You have gloves, masks, mouth-to-barrier devices, eye protection, and gowns and aprons. Make sure you know those. That's a quiz question. So after an emergency, you're also going to need to clean up, right? Make sure you dispose of anything you use to take care of that emergency. If you need to wear thicker gloves over your medical exam gloves to prevent anything from seeping through, that can be important. Make sure you use absorbent barriers to soak up any blood and other bodily fluids. Clean the area with soap and water, and then use a disinfectant like bleach or alcohol or those types of things. And then you're going to discard the contaminated materials properly. Don't just throw them in the trash can. If you have access to a biohazard bag, use that. If not, wrap it in some sort of impermeable material like a plastic bag or something like that, and then throw it away. Because we also want to protect those that take out the trash. Okay. So next we're going to talk about how to remove gloves properly. Yes, there is a system of how to remove them properly, and here's how.
Skill: removing gloves. While removing disposable gloves, do not touch the outside of either glove with your bare hand. Pinch one glove on the outside near the wrist. Gently pull the glove off, keeping the inside out. Hold the removed glove in your gloved hand. Slide 2 fingers of your bare hand inside the remaining glove at the wrist. Gently stretch the glove away from the hand and gently pull the glove off, keeping the inside out. The first glove remains inside the glove just removed. Dispose of the gloves in a biohazard container or a sealed plastic bag. Wash your hands with soap and running water. If soap and water are unavailable, use an alcohol-based hand sanitizer.
All right. Now, if you do get exposed to blood or bodily fluids and you're worried about catching something, wash the contaminated area with soap and water. If you are at work, report the incident to your supervisor. They may have ways to get you medical care and get tests taken if needed. You can contact your personal physician for if you need to take some blood tests to make sure you didn't get exposed to something. If it was a significant exposure, go see your doctor. So, some things that you can catch if you're not careful. First and foremost, bloodborne diseases are diseases that can be in the person's blood, but also in different types of bodily fluids. Blood, vaginal fluid, semen, and like seepage from wounds, those types of things can all carry these bloodborne diseases. The 3 types bloodborne diseases that we're going to talk about is hepatitis B, hepatitis C, and HIV. Hepatitis is a disease that affects your liver, can be life-threatening and life-altering. HIV, you guys have probably heard of. It's an autoimmune disease that affects your blood and is very deadly. Okay. Airborne diseases can also be transmitted through care of somebody in an emergency situation. They're transmitted through the air by coughing or sneezing. So be aware of those. There are also some newer and emerging diseases like COVID, those types of things that you may need to be aware of when you're treating somebody. All right. So the last thing we're going to talk about in these emergency situations, there is a chance that you're going to be around some death. Okay, if somebody dies, some things that you can do to make the situation better. Try and avoid negativity, right? Be positive. Try and assure the person that you will locate their family. So if you're speaking to somebody who may die, make sure you assure them that you're going to locate their family and let them know. It's okay to allow for some hope, even if the situation looks dire. Allow them to feel like there is a chance that they can overcome and they can get better. Don't just give out information to others. We talked a little bit about HIPAA and confidentiality. Don't tell people things that they may not already know, right? It's okay to confirm something. If they say, hey, I know that was that person's car or something like that. Like, it's okay to validate what they know, but don't offer new information. Offer simple, clear information if somebody asks you, especially family members or emergency personnel. And then use a gentle tone. Okay, be kind, be nice, be a good person. All right. Make sure that you indicate that you and emergency personnel are going to do everything you can to help this person. Be realistic, but also try to be positive. Don't make any promises that you can't keep. And then be aware that the grieving process is real and that the person may go through it. Denial, anger, bargaining, depression, and eventually acceptance. As far as interacting with survivors, if you don't know whether somebody's dead or not, that's not your job. Okay. Confirmation of death is the sole job of a physician. Okay. It's okay to allow survivors of an emergency to grieve. Again, provide that simple, honest, and clear information the best you can. Offer support and comfort. And don't leave survivors alone, especially, if they're one person to survive an accident, they may have lost some people that are very important to them. Don't leave them by themselves until there is somebody there to care for them. And then again, using that gentle tone and reassuring touch. Awesome. So we talked a little bit about emergencies today and what to do. Make sure that you guys are on top of this information. If you have any questions, feel free to reach out. Thanks, guys.